Yes, dear viewers, thank you for joining us. In about 5 minutes, we'll be commencing the public talk shortly. So, the topic today will be on why early breast scan is important and why we shouldn't skip nor miss a mammogram. So, we would like to hear expert views from the breast radiologist and also caregivers account of a husband, and finally closing with a panel discussion with audience on topics that's close to your hearts on this matter. Next, I'd like to draw your attention to the breast cancer virtual run. And in an effort to advocate the regular breast screenings, GE Healthcare is proud to present to you the very first breast cancer awareness virtual run. So all you need to do is get moving and stand a chance to win a free breast cancer screening package. And this is for you or your loved one. So for the very first step, all you need to do is to scan the QR code, very easy, fill out the form, and we encourage you to also join us in our club. Our club is called Please Don't Ski. Okay, so just go and scan this, and you can run with your existing fitness tracking app or on your mobile phone, on your smartphone. Next, when you get moving and you track your run, we need you to clock a minimum of 10.5 kilometer in the month of October. Step 4, at the end of October, please share with us your achievement track record on the social media with the public hashtag. Hashtag will be please don't skip and hashtag GE. So the fifth step will be screenshot your run achievement post and email to us at asia.event@ge.com. So that's so simple, right? All right, we'll be back shortly right after this. Let me just hang on to this QR code so that you guys can scan it over right now. And in 2 minutes' time, we'll be starting. Yes, ladies and gentlemen, thank you for joining us today. And we will be commencing on this public health webinar why early breast scan is important, and why we shouldn't skip nor miss a mammogram. So let's watch this video right now.
Hi, I'm Tina. I'm sure we can all agree that making time to get a mammogram isn't always easy. Finding the right doctor is half the battle. It's personal, especially when it comes to getting a mammogram. So a lot of times we reach out for advice, and we even ask friends. But when it comes right down to it, we often choose a doctor based on reputation. And when we finally find the right doctor, it's the trust that makes us stay. When I go for my annual exam, I want to make sure that my doctor is using the most advanced technology available today. I've done the research and found out that GE now provides a new machine that helps mammograms become a more comfortable experience. It even has a 3D option that provides superior diagnostic accuracy at the lowest dose of all FDA-approved systems so that doctors can put minds at ease. Whether your breasts are big or small, fatty or dense, reading a mammogram can be difficult with overlapping tissue. In traditional mammograms, overlaps and cancers can hide. Think of it like a book with clear pages. The words blend in one on top of the other, making it hard to read. With DBT, radiologists can read what's on the mammogram more clearly. When cancers are found early, they're easier to treat. When it comes to detecting cancer, I want to make sure that my doctor has all the technology to help send me home healthy. Because it's my health, and at the end of the day, it's my life.
Every woman's breasts are different. Having dense breasts is normal. It just means your breasts have more fibrous and glandular tissue than fat. When a woman's breasts are found to be more than 50% dense, mammograms alone may not be adequate for screening. Breast density is identified through a review of your mammogram. For women with dense breasts, both dense tissue and cancer appear white on a mammogram, which can camouflage cancers. However, ultrasound displays cancer as black against the white tissue, helping doctors find hidden cancers. If you are informed you have dense breasts, your physician may suggest another screening exam with 3D automated breast ultrasound.
Yes, thank you. A very good evening, ladies and gentlemen. My name is Charlene. I'm from Singapore, and you are now watching a public health talk on why early breast scan is important and why we shouldn't skip nor miss a mammogram. So thank you so much for tuning into this webinar on a Saturday evening from all parts of the world. And today we will be hearing from our expert on views from the breast radiologist. So today with us, we will have Dr. Teresa Buenaflor. Hi, doctor. Would you like to wave to all of us who's watching you?
Yes. Hi, good evening. Good evening, everyone, and those who are watching. Thank you for your time.
Thank you. And also today we'll be hearing also from a caregiver's account of a husband, Kun Witawat Lohamas, and all the way from Thailand. Witawat, are you here? Would you like to wave hello to everyone? Say a few words, Witawat.
Hey, Good evening, everyone. I'm Vitawat, live in Thailand. So thank you for give me a chance to talk on this webinar.
Yes, ขอบคุณค่ะ And we will close off with a panel discussion today on topics that's close to your heart on this matter. And we highly encourage all the viewers who's watching us right now to start to chime through your questions for a doctor or for Witawat, our caregiver. So during the live stream, if you have any questions, go ahead and pen down in the comment section so that we can also take it later on during the panel discussion. So right now, I'd like to give a little bit of an introduction about Dr. Buena Flor. She is a breast radiologist with strong experience in screening and also diagnostic breast imaging services in various settings, including inpatient and outpatient, dedicated breast centers of a tertiary private hospital and a private women's imaging center abroad in the Philippines. So currently, she heads the diagnostic imaging and also the interventional services of a freestanding breast center at the Centuria Medical Makati, and this is in Philippines. So without further ado, ladies and gentlemen, let us now invite our keynote speaker, Dr. Teresa Buenaflor, on her topic of what kind of breast screening. So, doctor, please.
Good evening, everyone. I am Dr. Maria Teresa Bonaflor, and I would like to share with you tonight a skip a mammogram or miss a cancer. First of all, I would like to share that informed women are empowered women, and there are four parameters or pillars of what constitutes being informed and being empowered. And those are breast self-awareness, breast self-examination, a clinical breast exam given every year for women, especially 40 years old and above, and to have a mammography. Now, first we start with breast self-awareness. So what makes breast self-awareness? It is the ability to feel or be intuitive about what is wrong with oneself. Meaning, you notice changes that come either on a regular basis or not, and you are able to spot those differences. So you know that your body goes through cyclical changes because of the hormones and all of that. So the first step is being able to determine what feels normal to you and when something doesn't feel right anymore. So the second thing is a breast self-examination. So there are a lot of literature or resources out there about teaching you how to do breast self-examination. But what I would like to emphasize more of is that you have to be comfortable doing this to yourself, so that you are also able to be familiar with how your breasts feel. I understand that there are some reservations about doing this, but it can save a life, and that is why it is very important to learn how to do your breast self-examination. So as these images show you, you can use the pads of your fingers to do a more a stepwise approach on how you're doing your or how your breasts are being examined. Okay. Next, why is this important to be able to do regular self breast examination? Now, for these sizes of these round things that you see here, I'd like to point out that for women who do get regular mammograms and clinical breast examination performed by a physician or an experienced nurse or other healthcare personnel, they are able to pick out as early as small as 1 centimeter. Now, for women who do perform regular self breast examinations on themselves, they are able to feel something when it is about 2 centimeters. However, for women who don't perform regular self breast examination, by the time they feel something, it is about the size of a ping pong ball, which is around almost 4 centimeters. Okay, now when we send for imaging, we usually separate them either into the screening or with a diagnostic. Now, when we say this is for screening, it means that our patient doesn't feel anything, and this is done on either on a yearly or every 2 years. It depends on which country you are in. Now, for those that are diagnostic, these are the times when the patient already feels something, or there are already changes in the breast that makes them feel afraid that something is really wrong right now. And the signs of the breast cancer are shown here in this picture are such that I hope as ladies, you don't get to that point that you will only seek consult because you already see or encounter these changes. That is why I emphasize so much that very early on you have to learn how to do your self breast examination and find out what you can early on. Okay, now we will touch on a bit on the mammography, but first I'd like to discuss with you something I think that gets thrown around as a term, but people don't really understand what it means, and that is breast density. So basically, what is breast density? So in the breasts, there are a lot of structures. So you have your glandular tissues, there are muscles, there's fat, there's skin, and all that. So when X-ray in mammography goes through all of these structures, depending on what kind of structures they are, that those are the ones that will be reflected on the image. So for the breast tissues, which are termed as a combination of glandular tissues and fibrous tissues, it looks as white on the mammogram. Now, if you look at these images of the breasts, it is divided into non-dense and dense. So what it means is that if you have more of fatty tissues or just a bit of breast tissue, you are under the non-dense breasts, which means it is quite easy to spot cancer because cancer can appear as white. So in a white against a gray background is very easy to spot. However, as you have more breast tissues in the breast, the whiter it becomes. Now, white against white is going to make it a bit more challenging to find cancer. And this is what we term as the masking effect of the breasts. So aside from that, just having dense breasts alone gives you a 4 to 6 times risk of breast cancer. And that is why we are being very adamant about getting women screened and checked. Okay, now in the Asia Pacific region, we do have unique challenges in our setting in terms of screening, in the diagnosis and the management of breast cancers. One, not all of the countries have screening programs. Another is that there is lack of access to imaging equipment and diagnostic testing. But I think another thing that I would like to emphasize also are the patient misperceptions of the disease and the treatment. So I'd like to go through about, let's talk about your fears. The more common fears that I hear from women are that, one, there is the fear of radiation. They don't want to get a mammogram because there's extra radiation from that. So just to look at this image, when I say annual background radiation, that means this is the natural radiation that you get just by standing outside under the sun. So in a year, you get about maybe 3 to 10 of the radiation dose. Now, in comparison, you look at the image that says mammogram. It's very, very small, not very significant amount of radiation. So just to show you that a mammogram is safe and has been proven safe for a long time. So I think that's one point that I'd like to share with you. Another is the fear of pain. And I know most women, they don't want to get a mammogram. It's because it's painful. Now, look at these two images. One on the left is that of a film or an analog mammogram. The other one is digital. Now, in a film, it's taken with a different type of technology then compared to a digital. You compare it to something like a smartphone. So if you look at the differences, before, the reason that they had to compress the breast so much was because they needed to have the x-ray go through so that it can visualize it really well. So if you look at the older generations that had or had an experience with film mammography, they will really tell you it's painful. Another thing is that we try to avoid when women are in their mid-cycle and are having more tender breasts, we try to avoid not to have their mammograms as much as possible because it adds to the pain. So other than that, I think now with newer technologies, they've been able to address this, but I think more on a psychological aspect. We need to change our mindset about our fear of pain. Okay, now I would like you to meet some ladies, and actually not their actual ladies, but some of their imaging that I would like to share and their patient journey as well. So for this particular lady, she came in, she doesn't have any symptoms, so we call them asymptomatic, and she has no family history of breast cancer as well. So if you see this area that has a pink box, and that is a finding that we look for, that can signify cancer. And this is something that is not a mass. These are called microcalcifications. And a mammography is able to pick this out. For this lady, she ended up with a very early cancer, and she underwent just a lumpectomy in her case. Another lady now, she's 40 years old. She had cancer when she was in her 30s, about 31, but she opted for a lumpectomy then. So this was 9 years ago. Now she comes back for a regular screening mammogram. Likewise, she doesn't have any symptoms. And then it shows here that she has also these calcifications in the left breast. And since she already has a history of breast cancer, these were subjected to a biopsy. And true enough, it did turn out to be an early cancer as well. Now for this next patient, I remember her, it's because she just had her mammogram. It's because her other friends and relatives then, they all went together, and she just said, okay, I'll just have my mammogram as well. Then we see this finding in her breast. Likewise, she cannot feel it. This is called an architectural distortion. Now, this is a newer kind of mammogram called the 3D mammogram, and that it is able to pick out some features of cancers well, and likewise, this is not a mass. Now, if you look at this also turned out to be an early breast cancer. Now, for this other lady, I saw her fairly recently. I saw her before in 2020, and then now. And then I noticed that there was something that grew in this area with a pink arrow. So likewise, she has no family history of breast cancer. And she's not very regular also in terms of doing her breast exam. But when I palpated her breasts, I did feel something hard like a marble. And then when I took the ultrasound, now you see something that is abnormal. And this is about 1 centimeter. And this turned out to be an invasive carcinoma. And actually, she is now due for a planned lumpectomy. Now, my point being with those ladies that I wanted you to meet is that their patient journey is different. different from these ladies that I now show you with very abnormal looking breasts. This lady here with in the second image that has a skin thickening, her nipples are retracted. And for these types of ladies, you can pretty much, even just looking at their breasts, that something is going on. And the more symptoms that we see, the likelihood of it being locally advanced is actually higher. And likewise, that tells me that I have to investigate a bit further from the breast, because there might be some areas now that might be involved other than the breast. So this brings us now to a very important percentage that I'd like to share with you, that in 95% of women, the survival rate is at that percentage if we catch the cancer when it is 1 centimeter or less. At the same time, this fairly new study also turned out that the risk of death is actually cut in half, in 50%, for women who faithfully attend their breast cancer screening. So to wrap it up, I just want to share with you just in the patient journey from even before the diagnosis of breast cancer. I'd like you as women to be more proactive in being aware on what is happening with your breasts, to seek medical consult when something doesn't feel right anymore.
Thank you so much, Doctor, for sharing with us. Well, we can see that a lot of things has been shared. Whether you are young or you're old, you might be susceptible for breast cancer. And why self-examination is equally important, and whether you have a family history may or may not affect the chances of getting the breast cancer. So we already have quite a number of questions in the YouTube. So maybe I'd like to invite Doctor back again with us to take on the questions from the floor. So we will have a 10-minute Q&A, and I will strongly encourage all of you who's watching us live right now to go ahead and pen down your questions, because this is like your 10 minutes of like a personal consultation.
Yeah, one-on-one.
Yeah.
Okay. Yeah. Thanks so much, Charlene, and thank you for the ones who put in their question. I really appreciate the fact that you took out the time to do that. So let me run through with some of the first ones. I know, as I've touched on with my lecture, that women are scared of the pain, right? So as I've said, there are a lot. If you look at where you live in the locality, you can ask for if it is available, if they have digital mammograms or digital breast tomosyntheses. The newer machines are actually much more gentler on the breast, and there are certain technologies that actually lets the patient control the amount of compression, and these are what they call patient controlled compression. And aside from that, I think there are women who have very, very sensitive breasts. I usually will advise them to maybe take some analgesics if they really are a bit hesitant about getting their mammogram and scared of the compression. I think that's the question regarding pain. And I think another question that I saw is that, do men get breast cancer? Yes, definitely. It happens in about less than 1%. So as a point of, I'd like to make a point with men. There are different populations of men that are a bit more prone, or the ones that we look out for, especially if they were treated with or had prostate cancer, and then they are on a certain treatment regimen that makes their breasts grow. So we have to differentiate whether it's because of the medication or it's because of something else. And yes, the treatment for men, if they do get breast cancer, sometimes they will still get a a mastectomy.
I see. Okay. Thank you for sharing with us, because we have quite a number of questions. That was the top 2 questions.
Okay.
I think traditionally we all know that it's going to be quite painful, but what went through during your course of presentation, we realized that the new technology has enhanced, breast screening. So that is really truly like a dove that brings great tidings for us. Next question from the ground, from the audience who's watching us live right now. There's another question. It says that when should women start to have the breast cancer mammogram done?
Okay. Right now, there are, when we look at just, we don't look at women that, okay, it's all 40 years old and above. That is the standard when they are of average risk. We also look at the risk factors of certain women, because there are those that are of higher risk. It's going to be a longer discussion, but I would just like to point out that there are subset of women that are of higher risk that we tend to work up much earlier than the 40 years old. And then there are also cases that it doesn't mean that you cannot get a mammogram when you're less than 40. If we deem it important or necessary to work up a finding further, even when they are between 30 to 40, then we do so. But we make sure that we have a basis for doing that, because we do follow a principle called ALARA, that means as low as reasonably allowable. So we also look at the pros and cons. We cannot just send like a 20-year-old to a mammogram if we don't have any basis for having her undergo. I mean, if the physician can look at the clinical exam first and maybe do an ultrasound, then maybe that can solve the problem, but not to jump to something that is not going to be necessary or needed in her case.
So, do you also suggest that if they already have like a family history, say the grandma, the mom, and say the aunties all have like a history of like breast cancer, and this group of people should start to have their mammogram as early as possible? And maybe at what age would you recommend those with
Okay.
family history to start?
Okay, for those with family history, we actually look at not just breast, but also if they have ovarian cancers. Because the ovarian and breast cancers tend to be, we look at it like they're cousins, right? So the risk is about similar if there's a family history of ovarian cancer. So for those who have a first degree relative, for example, you have your mother or your aunt was diagnosed at age 45. So for the like for the lady who is, we look at the 10 years, we look at, they can screen the first degree relatives minus 10 years of the age of the one who was diagnosed. So if the one was diagnosed at 45 years old, then they can actually start screening at 35. But in some instances wherein an MRI is offered, then they can actually do an MRI even as young as at 30 years old. But that's subject to the discussion with your physician.
I see. That also
Yeah.
brings us to another question from our viewers. So, if we do this mammogram and if it's done yearly, could we be also exposed to radiation? So, if you do it yearly, that would be quite scary. So, that was a
Okay.
comment and also a question.
Yeah. That is why in my lecture, as I said, the first thing I tackled was like the fear of radiation. So in mammography, they all follow a specific measure of radiation dose that should not be above a certain level. That is why the if I look at the comparison of the radiation that we're getting from the natural sun and compared with that of the mammogram, it's actually very not significant. So as I've said, it in a yearly basis, they've also found out in studies that it doesn't have like a cumulative effect. That and in that level, in that dose that the mammogram has, which is okay, the dose is 2 to 10 for the natural background radiation. So mammogram is about 3 and below. They found in studies that there is no carcinogenic effect if even at the range of 2 to 10. So the background radiation that we get is up to 10 millisieverts. So I hope that sort of clears also the hesitancy of women about, I think I might
Exposed
get
to too
extra
much
radiation.
radiation
Yes. There's no such thing. You will probably get more radiation by
from the sun.
riding an airplane Yes.
I see.
From here to Singapore.
Thank you, doctor. And also a final question from the floor for you, from Tina. I think it's a lady. So, hi, doctor. Can women with dense breast do anything to have less dense breast?
Okay, I wish I could give you a good answer for that, but that's really a genetic thing,
Oh,
And as I've said, the breast density is actually just determined by the mammogram. So it's the mammogram that tells you whether you have dense breasts or not, and it doesn't. It for some reason it's just like on a racial thing. It actually more Asians have more dense breasts compared to Caucasians. So that's why we are a bit more, we need to educate more women about what breast density means because there is that risk associated with it. Yes. But no, sorry, I really cannot recommend anything to lessen the breast density.
thank you. Well,
All right.
yeah, I think that was a very good question. So,
Yes, I agree.
unfortunately, I think as Asian women, we
Yes.
genetically we would have dense breast. So there's no way
Yes.
to do any sort of test. But I think a self-examination, like what doctor has mentioned earlier, is always important. Yeah.
Yeah.
So don't skip mammogram too. Okay,
Yes.
so thank you, doctor, for sharing with us.
Thank
That
you.
was from our doctor's point of view as well as our expert view. And next, of course, we all
Thank
understand
you.
that if you are suffering from breast cancer, not only you, perhaps your caregiver would also be going through some kind of tremendous stress, and support from them is also important. So, as we will have doctor to join us back for the panel discussion. So right now, I would like you to watch this video about this particularly inspiring caregiver.
ผมไม่เคยคิดเลยว่าชีวิตจะพังทลายใน3 สัปดาห์ภรรยาผมเป็นมะเร็งระยะสุดท้ายในขณะที่ผมตกงานตุนเข้าใจผมผมจะผ่านมันไปยังไงอยู่ในงานปาร์ตี้แล้วมีคนมาดับไฟมันมืดไปหมดถ้าผมล้มแล้วใครจะดูแลชีวิตที่เหลือ
แม่อย่าทิ้งหนู
แสงสว่างเล็กๆนี่แหละแสงสว่างที่ทำให้รู้ว่าเราไม่ได้อยู่ลำพังทำให้รู้ว่าคำว่าเพื่อนมีค่าแค่ไหนทำให้รู้ว่าปัญหาจะหนักแค่ไหนก็จะมีทางแก้เสมอเพียงแค่มีกำลังใจสิ่งนี้แหละได้สร้างครอบครัวของผมให้กลับคืนมาอีกครั้ง
พลังเชื่อมโยงที่ยิ่งใหญ่จะไม่มีวันสิ้นสุด
Thank Thank you. Yes, I wish that you guys can also join me in having applause for my next person who's joining me. But unfortunately, we are all like virtual and it's impossible to clap. But personally, I think I should give him a round of applause. Thank you. And we have Kun Witawat Lohamas, and he's located in Bangkok, Thailand. Hi, Witawat, would you like to just say hello to everyone once again?
Hi, thank you, Shalene, and thank you to everyone. Thanks for your watching.
Yes, and there was a short clip about Witawat's journey together with his late wife. And the Facebook page was called Noon Super Mom, which he uses to share their story. And this page has continued to provide support for doctors, nurses, patients, caregivers. And since I was just having a chat with him, and since inception till now, they have about 600,000 fans already. So that's why I want to give you a big round of applause for, supporting the community and rendering all this help that it's really, really important for all the caregivers. All right. So once again, right now I would like to welcome back Dr. Buena Flor to also join us. Doctor, would you like to turn on your camera as well? So this is going to be a panel discussion because just now we have quite a lot of questions for Doctor, in fact. But of course, right now I know that there are also people who are watching us and they are going through the journey as a support, a pillar of support, or a caregiver for someone who's going through the breast cancer. So maybe we'll have a quick chat with Tawat first. And if any point of the live stream, go ahead and let us have your questions either for Witawat or even for Doctor. We'll try to help you along the journey because today's webinar is more about learning and helping. So let us know how we can help. So first up, Witawa, I really want to know, can you tell me when your wife was first diagnosed with breast cancer? How old is she, and is it like a advanced breast cancer?
Okay. So it has happened in 2012, and before she diagnosed, she worked so hard because she need to look after our small coffee shop and also our children as well. So one day she felt very weak with stomach pain as well. But she afraid to go to the hospital with our husband. And then she decided to go to the small private clinic there by my house, right? And the doctor said she has an enlarged liver. And he advised us to go to the big hospital. And on the next day, I took her to the hospital. And she passed so many tests. And the outcome was she has multiple lesions in her liver. And she has two big lesions about 7 centimeters in her liver. So this is the start of our journey. And next 2 weeks after that, a doctor said she is getting the last stage of breast cancer. It spread to liver and bone. So final stage already.
So that was the final advanced stage. How old was she when she like first realized that certain symptoms, but maybe is it that she kind of just ignored it, or why did it became like advanced stage?
Actually, on that day, she just first 29. She just 29, right? We never think about breast cancer when we was 29. Yeah. I can remember that she told me that she has lump in her breast. I asked her that, is this hurt? She said no. Then I said, if no hurt, then that should be okay. And we ignore that. And I can remember 6 months after that, she told me that she feel stomach pain. It's linked to the her liver already that time.
That's very fast, and you are right about. I think most of us would think that at age 29, we would really cast this topic aside.
Yeah,
Like, how could it be? Like at 29, breast cancer, nah, no pain. Most of us were like, oh, no pain equals unlikely. So I think
correct.
that is a misnomer, and thank you for sharing with us this story so that it really will sound an alarm in us to let us understand that certain symptoms are not painful at all,
Yeah,
and it could
yeah,
happen at a young age, not just like what doctor said.
correct.
Like most people would think at age 40, then you start to get a mammogram done. So
Yeah,
yes,
correct.
thank you. And so can you personally also share with me how do you feel when your wife has been diagnosed with an advanced stage of breast cancer?
Yeah, so it's like a nightmare, right? So we just start small business.
Mhm.
I mean, for her, and we have two little kids, and we try to have better lives, same as all of you, same as everybody. We work so hard, both myself and her as well. But this should not happen with us. We should have work. We should have success in life, work, family, and so on. But it just come with no reason. But when I look at when I look at when I look at her, she's very sick. I look at my two young kids. They're just they're just 1 year and 4 years, right? Very young. So no one can take care of her. So I have to be more stronger as
That's
the
right,
husband
because
and the
as the
father as well,
husband and the father, right? Yeah, yeah.
with no
So
choice for me.
yeah, I
Yeah.
think doctor can also chime through because I think earlier when we had chat as well, doctor was filled with empathy because it's really hard to it's really hard to be a caregiver. The kind of like support you need to be always the cheerleader, and also you need to keep everything together, and you need to also make sure that your livelihood is not affected as well. So that it's multifaceted um, stress and challenges that you have to face as well. So yeah, so doctor was also filled with a lot of empathy during this little chat with you. So maybe you can share with us what is the major who is your major who is the major support during your wife's treatment? Is it you,
So actually, yeah, it's just myself
mm,
because we are a
family,
small
like your
family,
parents?
and also
If the doctor
yeah, we
can do
got some
anything
help from our family and parent as
Mm,
well.
mm.
But because actually we are not like a rich family, we still need to work to for the family and for everyone. So, but the main one is myself. Is myself.
Mm, mm, mm.
So I need to manage emotional whenever I need to take care of her, and I
And the
cannot
children.
like I have to make her more happy as much as I can do.
Mm.
We didn't talk about the disease too much often, right? We just
Mm.
talk when we need to go to see the doctor only. Yeah, and this can help to manage patient emotional as well.
Can
If
you
he
tell
has,
me, is
if
it like, can you tell me that is it like expensive the treatment? Because we also have a question about the treatment. So did it cause the stress for you?
it's too much stress, because advanced breast cancer will need like heavily treatment and need to use the high cost medicine as well. Actually, we also have like standard treatment provided by government, but sometimes, especially for advanced stage of breast cancer, is has high chance to use the more expensive one. More expensive one is meaning more newer drug, like newer medicine, like targeted therapy, like immunotherapy, which is not traditional chemotherapy.
Mm-mm-mm.
Mm.
Yeah. So one of the questions from the audience was saying like, how do you juggle? I mean, they feel really sorry to hear the story, but the question is, how do you juggle? Because I think a lot of people, when they face adversity, what they draw the strength will be from the inspiration from other
Mm.
people.
Yeah,
So tell us, how do you juggle all this?
because meanwhile, even my wife is very sick, but meanwhile, I still need to think about the way to make her more stronger, right? If she can inspire other people or other patients, she will feel more better that she have to be stronger for other patients, for her community as well, right?
Mm,
This is the kind of just a trick for me,
mm,
right? Because one story is that even she feel very sick that time after she has got like 3 course of treatment, she feel very much better. I told you that at the first diagnosis, she has multiple liver,
Lesions.
multiple lesions in the liver. But after 3 months, all of them has gone. This is very big inspire story that benefit to doctor, benefit to the nurse who need to take care other patient as well. So her story can help people to trust in the new treatment,
yes, in the
trust in
healthcare
the medicinal
system as
doctor.
well as the
Yes,
doctor. Yes. So
yeah,
that's why doctor is also a strong support in that sense, not just
correct.
Yeah.
family members.
Yeah, just to add on to what Witawat was saying regarding, I think there's also the misconception about cancer. So when people hear the word cancer, they think it's just one kind. There's actually a lot. There's a spectrum of it. So there are the ones that are not very aggressive, or we call them like the behaved ones, or the ones that are very, very aggressive. That we have to be a bit more aggressive, proactive also in terms of treating and diagnosing these women, especially with younger women, because of their age, less than 40 years old. Their tendency for their tumors to be more aggressive and more resistant is higher. That is why, for me personally, I don't also like to, just for not to dismiss something that something doesn't feel right. And
Mm.
also to add on, pain is also not a very good indication that something is going on. Pain is, if we look at it, if it comes and goes, but more often than not, cancer is silent. So the only time it manifests itself is when it's something that is already a bit on the locally
Yeah,
advanced stage. Yeah.
yeah.
Thank you, doctor, for sharing. Yeah, some viewers were concerned about the mammogram. Is it available in rural areas? So maybe particularly like in Philippines, maybe you could share with us.
Yeah, in some areas there are in the rural areas there are what we call provincial hospitals. So I think there has been some move in the local government level, and also from the support from the Department of Health, that they've been actually putting in machines or better technology of the mammogram. So I think it's a matter of finding out where their locality is, and most likely the bigger hospitals or their provincial hospitals will actually have that.
Thank you.
Yeah.
Thank you, doctor. And back to Witawat. So the question is like, how do you manage kids? Because kids' emotion when they learn about the mom, it's like very thick. So how do you break the news?
Um, so luckily I have her mother, let's say grandmom. Um, she will take care. She's take care of our kids. I just pay attention to my wife only
Mm,
and just focus on money about financial things. right? But it's just a teamwork. I just leave about the kids. I just leave my kids to her mother, and I do other things instead.
That's true. That's true.
Yeah.
I think, yes, what you have pointed out is very right. It's teamwork. I think just one person juggling everything, that would sound almost impossible. And many times, if you're just juggling this by yourself, it's a tremendous mental stress also on the caregiver on the long term. So that's a good tip, in fact, So
Yeah.
do extend to your family for support, especially like kids' emotion and all. And another
Yeah.
question from the audience who's watching us live: what are the type of support we can extend for cancer survivor? Because they also want to know more, so they can help people in the future. So, what are the type of support we can extend for cancer survivor? Maybe from doctor and maybe from Witawa. So maybe doctor, you can tell us what
Yeah.
kind of
Doctor first.
support.
Okay. For those who are interested to support, I think for me it's about sharing. If you think that you've learned something from us from Witawat's story, I think it's a good thing to share it, pay it forward to women who can. That is why when we educate and raise awareness, we'd like that it also expands. It becomes an exponential thing, right? And also as doctors, we also try to look for ways on where we can actually help out our patients. Like in some instances, like there are those that are of lower to mid income, so we try to look for ways where we can probably send them for where they can avail of medicines. And it's, to me, it's about tapping the network. So sometimes they might not be treated in the hospital or in this particular center, but we can send them or refer them to other areas also where they can get the treatment. Other instances also, we try to tap also the pharmaceuticals, because I do have one patient that the son wrote the company that his mom was undergoing treatment, but the treatment was too expensive. So he wrote the president of the pharmaceutical, and he actually responded, and then they were able to get probably half of the treatment shouldered by the pharmaceutical. So things like that, it's a matter of tapping into where. But I know as patients, especially those that do not have the know-how of the medical, I think Witawat's story and his network of helping patient navigate their journey, their cancer journey, because it is not just a personal journey, it is really a family journey. It affects the dynamics. And I'm truly honored to join you, Witawat, because I salute you with how you've managed everything. I mean, I cannot imagine what you've gone through, but you've inspired a lot of people, and I think that's a very important thing that you're doing for advocating for awareness.
That's right. I think Witawat's Facebook page has 600,000 fans. And if you like as well, there's a lot of resources there. So go ahead and be one of the follower there. But of course, other than having the support at the Facebook page, as a caregiver going through the journey himself, Witawat, share with us, what are your words of encouragement or from your experience that you could share with those who are currently being caregivers for any patient in their family?
Yeah. So what I can share is that as the caregiver, you have to stay in the reasonable and the present. You have to be more stronger, and you have to always look for other options, right? I know that it's very difficult, but you have no choice, that you have to be more stronger to support patient, because you need to use your brain to think about what going to do next and how going to do next. And doctor can help for sure, but you also can be doctor at home, which is very important, right? You cannot ignore any abnormal symptom. You have to keep alert yourself, because it can be happen many times while the treatment is going, right? especially my wife, he has got like brain lesion spread from breast to brain. So it's happened 2 times, and it's make me I need to like wake up like 2-3 a.m. for years, right? But it's no choice. We just accept it, and we just do whatever we can. But
just do your best, right?
yeah, just do our best.
Thank you, Witawa. That was truly inspiring. And yes, taking on the last question, we have about a minute to do this last question. I think a lot of people also wish to find out, is there any vaccination against breast cancer? So, doctor, tell us about it. I think everyone wants to know this.
Okay, if they can come up with a vaccine as fast as they could with COVID, I really pray that they would, right? But cancer is a long fight. You know, there's a lot of factors in it. There's genetics, there's the environment, it's what you eat, it's everything. Stress can also be a factor. So the only thing that we can have control over is how we are being self-aware, and how we educate ourselves, and how we are able to be, you know, also to reach out and teach other women. If we know this, then we can share it with them. So I think that's all I can say about that.
Thank you, doctor, for the great key takeaways. And also thank you so much to Witawa for sharing with us. Truly, I think we learned in person from you, and also furthermore from your Facebook page for those of you who wants to find out about the resources. I think that there is like years of experience in there, and whatever you're going through, he has gone through, and it's all penned down there. So thank you so much, Dr. Brenna Floor, and also Witawa for the tremendous sharing. Thank you, thank you, thank you.
Thank
And
you.
also to folks who are watching us live right now, always remember that early detection can save lives, and also knowing what to do next when diagnosed is equally important. And also, ladies and gentlemen, remember, please don't skip, because less skips will save lives. Okay, so thank you, GE Healthcare. This public health webinar on breast screening and also on breast cancer will be available in Thai next week. So please do watch out for our space itself. So this is the date and the time. That will be next Saturday from 6 to 7 p.m. GMT plus 7. So that will be in Thai language. So yes, you will see this our guest Witawa again, and also we will have another speaker. Pompey will be there to join you guys. So next, we will also like to highlight to you once again the breast cancer virtual run. So I like to flash this so that you guys remember, please don't skip. Less skip can really save life and will save life. So watch out for the space, and also in an effort to do this, please scan this QR code over here, and you might stand a chance to be a winner, because we're going to have 10 winners that will be announced at the end of the October. So you can get moving and track your run. So you need to clock in a minimum of 10.5 kilometer in the month of October. And at the end of the October, please share your achievement track record on the social media with the public hashtag. And the hashtag should be hashtag GE. Hashtag please don't skip. And also, please screenshot your run achievement post and email to us at asia.event@ge.com. So that's very simple. And I would highly encourage all of you to simply scan the QR code. And also watch this replay of the entire video on the YouTube. My name is Charlene. Thank you for watching, and may you all have a pleasant weekend ahead. Stay safe. And our speaker, doctor, and also Witawa, thank you so much. And to everyone who's watching us, thank you so much for joining us. Goodbye.
Thank you. Khop kun ka.
Thank you.